Assalamu alaikum. Good afternoon, everyone, and welcome to our webinar, Ultrasound Work-Related Injuries. I'm pleased to introduce my co-host, Ms.Bayan Alghamdi, a senior ultrasound technologist with extensive practical experience in daily ultrasound practice. Ms. Bayan has strong expertise in ergonomics and safe scanning techniques and injury prevention in the ultrasound workplace. Ms. Bayan, thank you for joining us today. We are so lucky and glad to have you with us.
It's my pleasure. Thank you, Abdulaziz. طبعا grateful for the invitation from Advanced Medical Imaging Technology. I will be discussing ultrasound work-related injuries, and it's important topic that sheds light on the physical challenges faced by sonographer in daily practice. طبعا في البداية أبغاكم تتخيلوا معي هذا السيناريو. At the beginning of the day, the ultrasound room is quiet, the machine is ready, the patient is comfortable, and the examination begins. What often goes unnoticed is a sonographer holding the transducer in the same position, repeating the same movement, patient after patient, hour after hour. At the first, it's only mild discomfort, easily ignored. Over time, that discomfort becomes persistent pain and eventually an injury. Until one day, scanning becomes difficult and continuing the profession becomes uncertain. This is not an isolated story, it's a reality faced by many sonographers worldwide. While ultrasound is safe for patients, it can place a significant physical burden on those who perform it. So, understanding ultrasound work-related injuries is essential to protecting the health of sonographers and ensuring the quality of this critical profession. Throughout this presentation, I hope to cover the key aspects of this important issue and highlight what every sonographer should be aware of. I will begin by setting the context of ultrasound work-related injuries, then discuss the main causes of these injuries and highlight the body areas most commonly affected among sonographers. After that, I will explain what safe scanning positions look like in daily practice and introduce some stretching and exercise strategies that play a key role in reducing muscle strain and preventing long-term injury. Next, I will share key recommendations to reduce the risk of injury, and finally conclude with the key take-home messages. When we search for musculoskeletal disorder among sonographers, we see thousands of studies from different countries around the world. This clearly shows that pain and injury in sonography are not isolated cases or individual experience. They are widespread and global problem. Behind every study listed here are real physicians or professionals suffering from neck pain, shoulder injuries, back problem, and sometimes career-ending conditions. They spend their lives caring for others, often at the cost of their own health. The large number of studies highlighted how serious and urgent this issue is. It tells us that this problem has been recognized worldwide, repeatedly studied, and consistently reported. Work-related musculoskeletal disorder are defined as work-related injuries and illnesses involving strains, sprains, joint inflammation, low back pain, and nerve compression syndrome. Causes for injury: repetitive motion. Perform the same scanning movement many times throughout the day. Over time, this repetitive motion places continuous stress on the same muscles and tendons, especially in the wrist, shoulder, and forearm, which can lead to overuse injuries. Poor posture or poor position. Maintaining poor posture for long periods, such as reaching forward, twisting the trunk, or bending the neck, increases pressure on the spine and shoulders. When these positions are held repeatedly or for long scans, the risk of musculoskeletal injury increases significantly. Transducer handling. Using a tight grip of the transducer or scanning with the arm held away from the body cause muscles fatigue. This constant tension, especially in the hand, wrist, and shoulder, can result in pain and long-term strain. Patient and equipment position. When patients or equipment are not positioned correctly, the sonographers are often forced to adapt their bodies instead. This leads to uncomfortable and unsafe posture that places extra stress on the neck, the back, and shoulders during scan. الworkload. A high workload, including long scanning hours, increased patient volume, complex examinations, and limited breaks. When the body doesn't have enough time to recover, small strains and build up over time lead to serious musculoskeletal injuries. Reluctance to report pain. Many sonographers avoid reporting pain due to fear or work pressure, allowing minor discomfort to worsen over the time. So, together, these factors create continuous physical stress, making the sonographers easily affected to work-related musculoskeletal injuries. Commonly affected body areas. طبعا أكيد shoulders are the one of the most commonly affected areas for sonographers, holding the transducer for long period, often above chest high or at awkward angles, creates constant strain on the shoulder muscles. Over time, this can lead to pain, stiffness, and even chronic injuries like rotator cuff problems. The neck and back more likely to be injured because sonographers often bend forward or twist to get the best image. Prolonged poor posture places stress on the cervical spine and lower back, resulting in discomfort, tension, and some cases, long-term musculoskeletal issues. The wrist and hands endure repeatedly fine movement, gripping the transducer tightly for extended periods. This repetitive strain can cause tendinitis, carpal tunnel syndrome, and reduce grip strength, which not cause pain but can affect also على scan quality. Elbow less common than shoulder or wrist, but still at risk, especially when extended for long periods or used to support a transducer against resistance. This can lead to overuse injuries, inflammation, and localized pain that may impact overall arm function. Key principles for a safe scanning position. Tips for avoiding musculoskeletal injuries in sonographer and prevention strategies start from chair and bed setup, sitting, standing, scanning arm, wrist, monitor position, and technique. الchair and البed setup, adjust the bed so your arm stays close, keep the patient near, and use pillows or wedges for support. Sit or stand with a straight back and relaxed shoulders. Keep feet flat. Use footrest if needed. Avoid leaning or twisting. Move the chair with bed instead. Keep elbow close to body and your arm relaxed. Also, a wrist straight to reduce strain. Place the monitor at eye level directly in front, avoiding turning head and the neck for long periods. Proper technique, use the Alara principle as low as reasonably achievable. بمعنى short scanning times, lowest power possible. Use a relaxed hand grip on the transducer, and the safest position is neutral posture, الباك يكون straight, الelbow tucked close, الwrist neutral, المonitor at eye level, the patient positions closed, and frequent breaks. This minimizes risk of shoulder tendinitis, carpal tunnel, and back strain. Before we dive into the details, let's take a moment to understand why stretching and exercise is so crucial for sonographers. Just like any skill, mastering ultrasound imaging requires not only knowledge, but also hands-on experience. The exercises shown here are designed to strengthen your scanning skill, improve accuracy, and build confidence in real-life situations. Wrist and joint exercise are important to maintain mobility and reduce the strain from repetitive wrist movement during scanning. Regular stretching helps decrease inflammation and lowers the risk of chronic wrist and joint disorder. Hands exercise help relieve tension from repetitive transducer handling and tight gripping. They improve flexibility and reduce stiffnesses in the fingers and the palm, which helps prevent overuse injuries and hand fatigue. And neck stretches are important because the sonographers often maintain forward head posture for long periods, which leads to neck stiffness and pain. Back exercise are essential because a prolonged standing, leaning, and bending place constant stress on the spine. These exercises help strengthen the back muscles, improve the posture, and reduce the lower and upper back pain caused by long scanning hours. Shoulder stretches help release tension from prolonged arm elevation and awkward positioning, reducing the risk of shoulder injuries. And it's actually worth noting that even short strengthening sessions between patients or during breaks can make a significant difference in reducing pain and preventing long-term musculoskeletal disorder. Recommendations for workplace improvement. Some researchers provide recommendations to prevent injuries and ergonomics guidelines to design workstations, such as improve ergonomics, like place the equipment and patient as close as possible to minimize reaching and twisting, take micro breaks every 20-30 minutes to stretch and relax muscles, simple stretching exercise for the shoulders, neck, back, and hand can help prevent injury. Vary patient exams. Perform different scans throughout the day rather than repeating the same type to avoid fatiguing and same muscles groups. Report issues early. Report any persistent pain or ergonomic concerns to management to address the issue before it's worsened. Work sites should have a principal treatment provider, الPTP, اللي هو a healthcare professional who is knowledgeable about musculoskeletal injury, who understand radiological work demands, and familiar with the musculoskeletal injuries and safe scanning technique. Well, PTP should assess work sites regularly, 1 to 2 times monthly, to spot risk and reinforce safe practices. وطبعا sonographers should attend or workshops on injuries وfitness and safe scanning technique. In conclusion, the formula is simple but powerful. Awareness plus safe practice equal minimized injuries. يعني by staying aware of potential risk in our work environment and consistently applying safe practices, we take control of our own safety. This communication not only protects our health, but also enhances productivity and builds a culture of responsibility and care. It's important to remember that quality of ultrasound imaging depends not only on technology, but on the health of the sonographer. The following take-home messages are not just recommendations. They are essential practices for long-term safety and professional sustainability. Protect your posture, prevent injury early, and sustain your career. At the end, I wish you high quality imaging and healthy injury free career. شكرا.